In the next several minutes, we will explore the application of hyperbaric oxygen treatment, dealing specifically with brain trauma and post-traumatic stress disorder in injured soldiers deployed in Iraq and Afghanistan. Hi, I'm Sarah Logan. I am your host for Brainstorm, a short documentary based on the book The Oxygen Revolution, authored by Dr. Paul Harch and Virginia McAuliffe. Dr. Paul Harch from New Orleans is leading a study to determine the degrees of success in the revolutionary treatment for traumatic brain injuries and traumatic brain injuries combined with post-traumatic stress disorder by hyperbaric oxygen treatment.
Hi, my name is Tina Hecker. My husband's name is Tim. He's almost a 20-year veteran in the United States Army. And he left for Iraq in 2008. And sometime between January of 2008 and March of 2008, he was involved in several different IED explosions.
I'm Dr. Paul Harch, and I'm a private physician, but also a clinical associate professor at LSU School of Medicine in New Orleans. One of the biggest frustrations with this has been the failure for others to appreciate the simplicity of it. And I suppose that's because I've lived this, and it's so changed my life. When this discovery was first made in our divers by me and my senior partner that I was working with on this at the time, I wanted to hurry up and shout this from every mountaintop in the country that we had a treatment for brain injury.
It was 6 years ago that it was first brought to my attention that hyperbaric oxygen treatment was a program that could help our men and women in uniform who have PTSD or TBI. And I've gotten more interested in this as I've talked to people who have actually had the treatment, one being a young Marine from Massachusetts. Secondly would be the grandson of Colonel Bud Day, who was a Vietnam war hero, received the Medal of Honor, and his grandson also had been injured in Iraq and has had the treatment, hyperbaric oxygen treatment, and also General Manning, who's a reserve general that was wounded in Afghanistan, a severe head wound, spent over 12 months at Walter Reed. And all three of these individuals that I've just mentioned have been helped and have returned to a quality of life that they would not have if it had not been for hyperbaric treatment.
But I'm going to predict, and it's kind of like what Babe Ruth did when he pointed to the center field fence and said, this is going over the center field fence. This is going over the center field fence. This is going to revolutionize medicine and neurology.
It was just by chance that I happened to learn about Dr. Harch and his therapy that was available to the soldiers for the traumatic brain injury and the post-traumatic stress disorder. And we got my husband into the therapy. And since then, the progress has been absolutely dramatic. He's smiling again, which is something that I haven't seen him do in a long, long time, roughly a year and a half. He started running again, which is something else that he used to love to do. And just after his injuries, he just couldn't do it anymore. He'd get too tired or, there again, basically just forget what he was doing.
I was dumbfounded. I just couldn't understand this. Here we had a therapy that had been shown to work in a generic way on chronic wounds throughout the body. The brain is no different, except that it's located in a different place in the body. Why could people not accept that this could be a treatment for brain injury when here we had this evidence in the divers and now trauma patients and so on? The beauty of this treatment is that it's reaching wider and wider circles of our society. Today in Washington, D.C., the House Armed Services Committee is meeting, and among their guests is Secretary Gates. A number of the members of the committee, one in particular, whose district is in North Carolina, where the Marines are stationed, is extremely upset over the inability to apply this therapy, even in a compassionate use fashion, to many of these injured Marines. He's going to be talking about this today and reading some statements about what is happening down here.
I'm pleased to say at the recent hearing on the Armed Services Committee, I confronted in the hearing with Admiral Mullen and also Secretary Gates to ask me if they were familiar with hyperbaric oxygen treatments, and Admiral Mullen said yes. And in fact, he's interested as well as a commandant, Conway. He and his wife both believe that this treatment will help our men and women in uniform who have head injuries. So we'll be meeting very soon, in fact, this week, with two representatives from Admiral Mullen's office, and we will be talking about how can we move forward and not continue to study. If the treatment is working and we can verify that it's working, then we ought to move forward with trying to treat men and women in uniform who have head injuries.
So essentially, we now finally have some brainstorming in Washington, D.C. on this subject and getting to the heart of the matter and what to this date is possibly the only effective treatment for the residual effects of traumatic brain injury and PTSD.
His troubles were even noticeable over in Iraq. He went from managing roughly 2,500 people a day on the battlefield to not being able to remember where he had been within hours of being in a specific place. And his phone calls to me became very short and, eventually got down to just asking me how the weather was. And most times he wouldn't even remember to ask about our children. When he came home, he and I have done carpentry work all of our lives, and I realized that he didn't know how to do simple things. He couldn't even read a tape measure anymore. And
yesterday, I praised Secretary Gates. I praised the Admiral Mullen for their concern for the injured. And I want to praise you both, as well as the Secretary of Navy and Marine Corps sitting here today. And I want to say to you down at Commandant Marine Wives down at Camp Lejeune, what I want to bring to you very quickly is that there is a process and a treatment to help our soldiers and our Marines and our Navy when they have PTSD, when they have TBI, and it's called hyperbaric oxygen treatment. I would like to ask you both, and maybe the Secretary of Navy and Marine Corps sitting there today, I would like to ask you both your opinion, because I will tell you, I was pleased with Admiral Mullen. He is going to have someone to come meet with me. He wants to see what we can do to move this study quicker than what it's taken now. Admiral, are you familiar with this process?
Yes, sir, I am, and the Commandant and I have talked about this in the past, and the comment that I made to him, and even though there may be some who can question the efficacy of it, my comment, if I recall, and Jim, if you want to add to it, was if it can help, if it may help, I'm in. So that's where I am. I believe that we should, for our people, explore every avenue that we can to help them recover from what are really becoming some signature wounds of this war that we're in.
So, thank you.
Sure. As I travel about, you can imagine a lot of people approach me with this idea or that in terms of how to treat TBI or PTSD. But I will tell you, I have seen none out there that I'm more encouraged by than what I would call at this point the ad hoc results of hyperbaric treatment. To the point where we have put the Assistant Commandant of the Marine Corps in charge of trying to speed the process of the protocol that Navy medicine must necessarily accomplish in order to rapidly bring this to treatment level for our Marines that we think are effective. In the meantime, there is a doctor down in New Orleans who treats people, and through some of our charitable organizations and so forth, we have sent forward those Marines suffering that we thought might be suicidal to get them into a treatment regimen, because it can't hurt. It can only help. And so even in those cases, we're encouraged by some of the things that we're seeing. So we think that we're onto something here.
Well, I want to thank Mr. Commandant, you and the Admiral for your statements. I wanted to get that on the record because I intend to work with my colleagues on both sides of the aisle to push this treatment for those in the Army and the Marine Corps. And I would really appreciate your commitments to our men and women in uniform. And thank you for those statements. And with that, Mr. Chairman, I will yield back. And thank you again for your statement earlier.
Thank you.
What the medical profession has struggled with is this lack of information. And it really came to a head in the 1970s when, in somewhat exuberant fashion, doctors found that patients, for instance, with diabetic foot wounds that they were treating, men, began to claim that they recovered erectile function. Well, in men, what is one of the very, very first symptoms of diabetes? It's impotence. And the reason is the very small nerves that control erectile dysfunction and the blood vessels that supply them are diseased. And so this very special function no longer works. And this, interestingly, is something that is a very common complaint in traumatic brain injury with our veterans. Their libido is gone. They have no interest. And it's another reason why the relationships and the marriages begin to fall apart. Well, what happened is, as these diabetics were treated for their foot wounds, simultaneously all wounds in the body were treated because why? We are treating the basic underlying processes and the disease states, which are the chronic wounds. These nerves began to work again. The blood vessels began to work again. And what came back? Erectile function. Well, nobody understood this. And it was widely criticized in the medical community, and the hyperbaric doctors also, in lack of understanding, could not defend it. And so, in the face of criticism and no defense, hyperbaric oxygen wilted as a viable modality, or one that was least respected in the medical profession. Well, today now we understand how this works. And interestingly, one of the underlying mechanisms with hyperbaric oxygen is an effect on what's called nitric oxide, which is a tiny gaseous neurotransmitter in the brain that controls tone of blood vessels. What is involved with erectile function? Tone of blood vessels. And interestingly, what has been shown to be the pathway of Viagra, Cialis, and Levitra? It's nitric oxide. So there's some similarities here, and some of the science is now coming together to explain the phenomenon in the past that hyperbaric medicine was so criticized for.
Since we've been down here, he hasn't been using his GPS nearly as much as what he was. The military, through the VA system, they gave him a GPS back in beginning of 2009 because he couldn't remember how to get anywhere. He would leave our house and couldn't remember streets that were, 5 miles from our house, and he's always traveled those. We grew up in that area, and he knows the area like the back of his hand. And that was all gone.
One of the things that's not appreciated, and it is probably the single most important item that has affected me, changed my life, and put me in this line of work, is the impact this has on people's lives. We don't realize that everything about us, our personality, our relationships, our ability to function, our job, our love life, our everything is controlled by our brain. And when our brain is injured, it is a confused operation in our head. And the only way I can explain this is that when we look at functional brain imaging and brain blood flow. In a normal person, there's a very smooth pattern on the brain imaging to blood flow. We have a brain that's essentially in balance. With traumatic brain injury, I've likened the injury to what happens if you shake a broccoli. The broccoli has the stalk, which in our brain are all of the connecting tracks, and they're very, very fragile. They're essentially somewhat crystallized mayonnaise. In other words, they have some firmness to them, but they're extremely delicate. It's almost a gelatin consistency. And on the outside of the brain is like the fronds of the broccoli. It all floats in a liquid. And when we are impacted by trauma, such as a blast explosion in Iraq, the brain is shaken violently. And as it does, those connecting tracks are snapped. And so what we end up with is essentially a brain with less bandwidth than we normally have. In other words, we don't have the tracks to carry all of the information that allows us to multitask, to think, to move our hands at the same time, to listen to a conversation, and to be a part of a lot of commotion, but in an organized way. And this goes right to the symptomatology of what's happening in so many of these veterans. After you have divided these tracks and lost the ability to transmit information, they can't handle commotion, they can't figure things out, they can't process, they can't think. And if you look at their brain blood flow scans, what you have is a completely disorganized brain, a brain out of balance, and a life out of balance. They have marital problems, they're violent, they're irritable, they're not employable, they're dysfunctional, they don't want to be out in public. Many of them are afraid of what they are going to do if presented with various situations. Because of the PTSD, they're constantly scanning the environment. Every object in the road is a potential IED. It's a total disruption of their lives. They're non-functional. And what happens? They become reclusive. They hide out. They're not doing their jobs. People cover for them, their families cover for them. What we have found is the same thing we found in the rat study. You restore balance to their brains. And when you have a balanced brain, you have a balanced life. And that is the beauty of this work. What is happening is people are restored to a lost life. They regain their self, their identity, their ability to function in their families, their jobs, their lives, and they regain their self-esteem. I mean, if you fix a broken arm, for instance, and put it in a cast, you really help somebody, and it's gratifying. But there's nothing like returning a life to function. And this is the impact that this is going to have on our injured soldiers. Have a facial droop, something very obvious externally. But what happens with blast injury, and especially in the current wars, these explosions are with very powerful munitions, and they're in extremely close contact or close proximity to our soldiers. In years past, with ineffective body armor and such, people died. But now they live, and they don't have the external wounds of it. But as I mentioned before, the brain is, of all the organs in the body, probably the most delicate and fragile. It's why it's floating in a water bag, essentially, which is the covering of the brain. It's a shock absorber, but even with that shock absorber, the brain is still extremely delicate. And what happens with that blast injury is you may not see it on the outside, but the inside of the brain is disrupted. And the manifestation of that are all of the symptoms that we see with traumatic brain injury. So while we don't have the external appearance, we have the internal damage that is going on. The problem is a very, very high percentage of our servicemen and women have been exposed to these blasts. Many of them have been rendered unconscious. And what we know from animal and human experiments and clinical situations, autopsy studies, is that if you have lost consciousness, you lose brain cells. It's that simple. In which case, there is a significant injury.
He couldn't remember where we got married. He doesn't remember a lot of family members. Didn't want to socialize with anybody, but now he's, even down here, he starts talking to people, and he's always waving at people, and he just seems so much happier, and his ability to remember things is coming back. He's starting to remember like numbers on buildings, which may not sound like a lot, but for him it's huge. He'll remember numbers on buildings. He's remembering phone numbers, which he hasn't been able to do in almost a year and a half now. His whole thinking process is coming back. When all this started, it used to be that you could talk to him, and within 5 minutes he would forget what you said. Now that's not the case. Now he's remembering a lot of stuff, and this therapy has just been phenomenal for him. To know that we have to go back home and try to fight with our insurance company, and convince the VA doctors that he should come down here to further his therapy, to continue building on what he has gained back right now. The thoughts of that just, it makes me really, really angry.
So our big problem now is to educate the public and the rest of the medical profession about this. And simultaneously, the reimbursement sources, for instance, the VA. And one of the problems that goes along with this is that, unfortunately, the studies showing the effectiveness and the benefit of this have not yet appeared in medical journals. There have been selected case reports, one of which I have just had accepted to a journal, and we should have a publication date on soon. Another is an article that is going in on the first group of veterans that I've treated here. But it hasn't been in the literature, and so it's not as well understood by doctors. As a result, for them, there is no proof. Where is the pressure coming from, though? It's coming from the families and the individuals who've been treated. Their individual experiences and testimonials are so powerful that they can't be ignored. And who are they gaining audience with? The people they elect. Congressmen and senators are hearing one person after another come into their office and tell their stories of a dramatic change in the lives of their brain-injured husband or wife who was injured in Iraq and Afghanistan, whose lives have now been completely turned around when all other medical therapies and medications have failed for extended periods of time. And of course, one of the people who had the greatest impact on this and is such a proponent and very visible spokesman is the very first military veteran treated with this protocol that I developed here, Brigadier General Pat Maney. Brigadier General. That's why he got treated. But the real reason behind his treatment was his good family friend is a hyperbaric doctor that I've communicated with for a number of years about the treatment that we were doing. And when General Maney, 37-year Army reservist, state court judge in Florida, was recruited to Afghanistan to help nation rebuild after the invasion, recruited by ex-Secretary of the Army Martin Hoffman under Gerald Ford's administration. He was blown up in their armored SUV, knocked unconscious, and in the subsequent year was totally non-functional. Kept at Walter Reed, given every therapy they had, nothing could pull this guy out of his cognitive funk and inability to function until his wife insisted that he get hyperbaric oxygen. Prescription was written. He got hyperbaric oxygen on the exact protocol I have here now, and he is back practicing law on the bench in Pensacola, Florida. Unfortunately, the doctor at Walter Reed who authorized this treatment was given an immediate 6-month leave. But with his testimony, his advocacy, and the advocacy of many others like him now, we are seeing these soldiers and our military members return to active duty, stay in the military, or go on to jobs and college. And it's a dramatic effect. That's where the pressure is coming for awareness. And soon we'll have scientific literature to back it.
My husband is actually one of the lucky ones because through a lot of research and a little bit of background of my own, I knew that he had problems. But there's so many veterans out there who don't have the resources that he has. And a lot of the family members don't understand what the brain injuries are and don't know what the symptoms are and don't know what to look for. And, the suicide rate and the divorce rate is just so huge right now for all these guys. It's just a shame to see these men and women putting in their time to get no help back. It's like they've been used for a purpose and now they can't serve that purpose anymore. So they're just pushed to the wayside, and it's just unacceptable. To know that someone just in such as my husband's instance has the capabilities that he did and lost them due to a brain injury, and that we have fought for months and months to get him down here. And that is a fight that I will continue to fight when we get home, because he needs to come back and he needs to continue this therapy to gain his life back. I'm noticing that he's able to go places on his own before, which is part of the PTSD, where he was afraid to go anywhere, didn't like being in crowds, no loud noises, just anything would set him off. He got angry at everything. Just to see him doing so much better and thriving in the way that he is, it's just a miracle. My kids are waiting every day to see him and find out, just what type of gains he has had since he's been here. This is just a phenomenal way for these soldiers to regain their lives, and it's very disheartening to know that there are so many out there who just aren't getting it and need the help and just have no avenues because nobody knows, or they're told right off the bat insurance company won't cover it, so they let it drop. And
There was a quote or a little aphorism I wanted to put in my book that my publisher wouldn't let me because she thought it was too inflammatory. But everyone in the lay public gets this immediately. It's intuitively obvious. But my saying has been that only doctors don't get it. And actually, I was preempted by Dr. Edward Teller, the father of the hydrogen bomb, the Manhattan Project, and so on. Edward Teller found the benefits of hyperbaric oxygen many years ago for a hip condition he had. And long after the hip condition, he continued to use hyperbaric oxygen. And in 1994, I got to have lunch with him. And I sat right next to him so I could ask him the very personal question that I understand you're continuing to do hyperbaric oxygen. And why are you doing that? And his answer to me was, we have every reason to believe and know that this benefits the brain. And the side effects are minimal. What do I have to lose? Well, he had a stroke in 1995. And Dr. Richard Neubauer sent him a hyperbaric chamber that he began to use approximately 2 weeks after his stroke. He totally recovered from his stroke and used it the rest of his life. One of the greatest benefits of treating these injured guys is the restoration of their family and the integrity of their family, the harmony of their family. When they come back from Iraq and Afghanistan after these brain injuries, many of them are not functional. For the wives, it's like having another child. Their memory is so impaired. One of our veterans' wives has related to us that she has to call him to make sure he got to work, has to call him throughout the day to make sure that he's doing what he's supposed to do, or if he goes out on errands, that he ends up in the right place, doesn't get lost, hasn't left his keys someplace, or has some other type of problem. They're so dysfunctional that they're barely operational in their normal life. And of course, in a family setting, once you have a father who's no longer acting as a father, but is a dependent, it's a tremendous strain on everyone. Couple that with the short-temperedness and irritability, the fact that they are then prone to violence, and you've got all of the problems that we read about in the newspapers every day. This is compounded by the fact that the medical profession has no treatment for this. Our only approach has been to give prescription drugs to treat the symptoms. And what we medicate these guys with are powerful, powerful psychoactive medications, many of which carry black box label warnings by the FDA that are associated with increased risks of suicide. And what are we seeing? A suicide epidemic in our veterans. So when we treat these guys and you restore them to function, you affect the family in a dramatic way. Their sleep is affected. Many of our veterans are unable to fall asleep. When they fall asleep, they can't stay asleep. They're awakened by terrifying dreams in a sweat, pounding heart. And of course, you wake your spouse up when that happens. One of the first guys we treated, his dreams were so bad they were throwing him out of bed. He'd wake up on the floor. You can imagine now not only a sleep-deprived husband, but a sleep-deprived wife, who, once the husband's gone during the day, if he is gone, she's having to take care of an entire household. It's a tremendous strain. And of course, we haven't even talked about the finances of it. If they're unemployable or not functional at their normal level, family finances are affected in a major way. Medical bills are and can be astronomical, especially if for some reason or another you're out of the service and you haven't been properly diagnosed. You're now on your own, and it can be a crippling situation in many ways. So one of the beauties of this is that we're finding that many of these problems are at least mitigated or ameliorated, improved to a degree where they're now workable, and the family can see a change. Many of the families, the situation has become so dysfunctional that it's hard to even imagine what things were like in the past when it was normal. Incapacitating headaches, now under control, are gone. In fact, if you read some of the literature on this put out by Walter Reed Army researchers, one of the primary distinguishing symptoms, there were actually two of them that distinguished traumatic brain injury from PTSD, were the headaches and the pounding heart rate, palpitations. And in 8 of the 9 veterans that I'm currently reporting the results of our treatment on, they have had a complete cessation or dramatic reduction in their headaches in a 30-day period of time. This alone improves their quality of life in a major way. Half of them have been able to discontinue and or significantly decrease their pain medications and or their psychoactive medications. And with that, they no longer have the drowsiness, the dopey feeling, the spacey feelings that are such a part of many of these medications, or the side effects of them. If we think of fatigue, for instance, when you have a brain injury, you have to ask the question, where are RPMs? RPMs of an engine, a car. RPMs are in the engine. Where are they in the human body? It's not the heart. It's in the brain. And when you've had a brain injury, it doesn't matter, stroke, trauma, radiation injury, any brain injury, you knock down people's RPMs, their normal idling speed. And how's that manifest? They're fatigued. They have no motivation. They can't get out and do things. Any activity becomes an aerobic exercise. And what we are finding is that this reestablishes energy metabolism in the brain. We see this in brain blood flow imaging. And with that, they're more active, they're motivated, they now want to get back to their normal lives. It's a fairly dramatic effect. And with it is the worst. One of our veterans came down here 2 days after a suicide attempt. He awakened his roommate accidentally. And when his roommate went in to check on the perturbation and noise, which he had no idea what was going on, this veteran was sitting in the corner of the room crying, pistol to his head, safety off, and was ready to kill himself. He managed to help get this guy on the phone with me, and we found out he was eligible for this study and brought him down here. This guy today is no longer suicidal, going back to now the service. He'll be retired very shortly, and he's going to be joining his family business. He has a new lease on life, totally changed. Another one was in the process of getting divorced from his wife. While he was down here, his change in conversation on the phone with his estranged wife was so different, and she noticed this, that she came to visit him. They are now terminating their separation and getting back together. So what we're seeing is not just an effect on symptoms, but an effect on the entire lives of these guys who have been so injured in the service of our country. And that's another beauty of this work. One of the ways that we can look at this, and an analogy that has helped other people understand what is going on in the brain, the storm inside these guys, these men and women's heads after traumatic brain injury and PTSD, was given to me in an account by a 5-year-old autistic child. This little boy who was so out of control after hyperbaric oxygen became more under control, told me that he had alligators and chainsaws in his head. When we looked at his brain imaging, you see a totally disorganized pattern of brain blood flow. And in fact, it was exactly what this child was experiencing. And that is the storm inside the brain of our veterans with traumatic brain injury. It's a disrupted metabolism and blood flow, and something they have absolutely no control over. It is literally a storm inside their heads. And hyperbaric oxygen is calming this storm.
What we feel is that the screening process for soldiers who may have traumatic brain injuries isn't nearly enough on the battlefield. More needs to be done to help these soldiers, and my husband has had migraines since day one from injury. And one of the things that we noticed was that they didn't even ask him if he had headaches. And I had to ship him aspirin because he couldn't
The
get enough of it.
single missing element in so many of the conditions we have in medicine is oxygen. And it's a basic substrate of life. And this is the simplest way to reestablish large amounts of oxygen and change tissues in a way that they can now metabolize better, restore energy function. The information is out there about this, but the lack of acceptance is what is so startling.
It's just a shame. We need to get more people down here to see Dr. Harch and give them their lives back. That's the main thing. Just let them have some type of life when this is all said and done.
But I'm going to predict, and it's kind of like what Babe Ruth did when he pointed to the center field fence and said, this is going over the center field fence. This is going over the center field fence. This is going to revolutionize medicine and neurology.
So we are poised at this moment, a few years into the third reintroduction of hyperbaric medicine to the world. Only you can determine whether we will carry the day this time or have to wait another 40 years for others to try to scale the walls of medical prejudice and overcome the lack of understanding about intermittently saturating oxygen-deprived tissues with oxygen. I so hope this has informed you and opened your mind to such a simple answer to restoring lives and families. I'm your host, Sarah Logan, and thank you for watching.